growing consumerisation of technology, coupled with increasing speed and dependability of wireless communication, is giving tablets an increasing role in frontline enterprise work. Though often criticised for lacking in technological innovation, National Health Service trusts across the UK have seized on the opportunities mobility offers to improve quality of patient care. But introducing new devices can present a number of challenges. Low impact on patient care and careful management of personal data, while keeping fast and efficient levels of service, are all important. We consulted 2 UK trusts to see how tablet technology has been added to their IT real estate, what the devices are achieving, and what special considerations had to be observed when rolling them out. Blackpool Teaching Hospitals NHS Foundation Trust serves more than 150,000 people in a particularly deprived area of the UK. In 2012, the Trust rolled out an Android tablet-based network for community health. By connecting through a Vodafone remote access system, the infrastructure's 10 megabit fixed link can support 200 users simultaneously. I met with Darren Kermond, System Development Manager at Blackpool Teaching Hospitals, to find out how the new infrastructure is transforming the work of mobile clinicians. So Darren, to begin, could you tell me a little bit about the working practices of mobile clinicians before the tablet solution came in?
Pre-2008, domiciliary-based clinicians, or clinicians that would contact the patients in their own homes or in remote clinic settings, would capture their activity within the patient's paper-based notes and in Excel spreadsheets and access databases that were dotted about the organisation in silos. From a management perspective, it's quite cumbersome and difficult to maintain. So in 2010, the organisation completed a deployment project which saw the implementation of a patient administration system that was used to capture referral information, patient information, saw a move over to electronic caseloads used by clinical teams. And the clinicians were able to capture each patient contact, whether it was a scheduled appointment or an ad hoc visit to a patient's home. They were able to capture that within the patient administration system, so it became a single repository for that data capture, so we were able to produce up-to-the-minute management reports, operational reports, and a suite of SQL server reporting services that we call Report Manager was developed in 2011 that gave the management that full suite of operational management reports.
And implementing this solution has actually cut costs, hasn't it?
The implementation of the patient administration system brought about significant changes in how certain teams scheduled their activity, so they planned it all in the future quite quickly. That brought about administrative benefits, but it didn't go far enough in terms of mobilising the workflow. There was still quite a lot of waste in terms of effort and duplication of effort in a clinician's daily orbit, especially around the capture of that electronic data. So we felt that if we mobilise certain parts of the workflow, like the scheduling, for example, that prevented the nurses from completing entries in a paper diary to say that they've got to visit a patient at a certain time. If we could remove that paper out the process, we could lift those schedules from the patient administration system into a mobilised workflow tool where they could update that information on the fly, and we could then reintegrate that data back into the back office patient administration system. So that's what's brought about the operational benefits, the reduction in travel time, obviously because clinicians aren't having to travel back to base to enter this information on multiple systems. It's freed up their time, so they've got more patient-facing time. So that's brought about an improvement in the quality of patient care and increased capacity within clinical teams to see more patients. So it's brought about quite a profound shift in service delivery.
Could you tell me a little bit about what made you pick the Vodafone solution in particular?
Some time ago, we partnered with a company called NDL that produces a suite of integration toolkits. One that we used for automating repetitive desktop processes to free up sort of admin time. Another integration toolkit that we use to move data about servers and update databases in the back end seamlessly. But they also produce a mobile toolkit that allows us to develop form-based applications or lift data into form-based applications so it can be updated in the field and pulled back to application services either in real time or in a sometimes connected model. The beauty of this architecture is that we can enforce a 256-bit AES encryption fully from end to end, so from the application server to the client tablet. That full data transmission is encrypted. The reason that we chose to deliver that on Vodafone's tablet infrastructure was the fact that we could use Vodafone's APN, which is a dedicated fixed link into the Trust network, which again is fully 256-bit AES encrypted. So the transmission layer is encrypted and the application layer is fully encrypted.
With the Information Commissioner's Office always ready to fine for lost or leaked data, security is of paramount importance in NHS IT. Unsurprisingly, Blackpool's mobile system is locked up tight.
The mobile architecture that we've got in place basically has 3 levels of security. There's the mobile device management security layer, there's the application security layer, and there's the network security layer. The network security layer is provided by Vodafone's APN that terminates directly into the Trust network. So the APN is accessed by the tablet devices. That terminates directly into the Trust network, so any network policies that affect desktop computers are also enforced on the tablet architecture. The mobile application security layer is provided by the NDL integration, mobile integration toolkit. That enforces a 256-bit AES encryption over the sensitive clinical data flowing between the workflow application that sits on the tablet back to the back office application servers that sit within the Trust data warehouse, the Trust SQL farm. The MDM, the mobile device management, is provided by Vodafone's sort of branding of AirWatch on the cloud, so we can administer, enforce any policies on the mobile device estate, and we can manage those from a central location.
James Earle is a community physiotherapist at the Trust, and much of his work involves interacting with patients in their homes. How has the tablet rollout affected him and the service users who rely on him?
I work for a rapid response team, and by the nature of that we have to respond rapidly to patient referrals in order to keep them from going into hospital. One of the ways we have to achieve this is through flexibility, and I think what the tablets brought us is that flexibility. So clinicians are not having to constantly return to base to do their paperwork, to fill in patient records, to look up scan results. When we're there in front of the patient now, we can access all those things and access the results we need to give that patient a full holistic assessment, which is what the patient wants. Whereas before, it was quite a disjointed practice. You would go and see the patient, you'd get the initial information, and you'd have to return to base to do all the next lot of work. One of the other big benefits is the reduction of paperwork by eradicating duplication. We're heading towards a paperless state at the moment, so everything that we hold record-wise will be kept on the computer, and we'll be able to access all that via the tablets in front of the patient as well. So that in itself will save us quite a lot of time.
It's not just remote workers who are benefiting from the enhanced levels of freedom that mobile technology offers. Bedford Hospital NHS Trust has recently worked with network management company Xeris to roll out a wireless network across its 400-bed, 2,000-staff premises. With the infrastructure in place, CIO Mark Austin is now beginning to introduce new productivity and communication services across the hospital. Could you give me some of the practical uses of your new wireless infrastructure?
So in terms of the wards, we've got the nursing staff using e-prescribing. We're currently rolling that out, and they're getting on really well, moving the laptop round. They hope to move to slates or tablet computers soon when they've sorted out Windows 8 on it. And that helps them in administering the drugs because they've already been prescribed and they know what is needed by which patient. So rather than going from bed 1 to 2 to 3 to 4, they can go to the ones in the next sequence where it may be more time related. So they can make sure everybody gets the dose at the prescribed times.
9 months ago, you had the Xeros wireless infrastructure installed. I just wondered if you could tell me a little bit more about how it's improved efficiency within the trust.
So Xeros can interrogate the packets and distinguish different applications, but it's mainly the firewalls that are determining where people are allowed to go. So obviously the NHS one's kept within the NHS, and it can go out over M3 to the internet, but it's not that fast when you're sharing it with the whole of the NHS. But our local internet connection is fettered over the firewall, so we make sure there's a blacklist of sites that people can go to that are relevant. But it's easier than we block normal webmail that would be considered personal use from the NHS data side. It's just simpler for the security policy.
Could you tell me a little bit about the hospital's security policy and some of the systems that underpin it?
Okay, so on the wireless network we decided to keep the different connections separate. So we've got separate SSIDs for the different networks. So we're broadcasting free. We've got one for estates for their PDAs, so they can acknowledge when they've fixed a door and then find out where their next job is. So if it's an adjacent ward, they can go straight there with a huge toolbox rather than having to go all the way back to estates to find out that they had to go all the way back to the same ward. The NHS network, the same as the wired, is on there, but it's with a very long encryption key. It's definitely not human. I couldn't remember it if my life depended on it. It's so long. And then we have the public sector guest network, and that's the one where we have a code that switchboard can give out in the night. So if it's blood and transplant that have come to sort out things about a transplantation, they need access to the internet from the ward so they can complete all their paperwork with relatives. And police and fire, if they're coming for meetings or major incidents, then they need access to the internet. It's far easier being given them a long word, but that is just routed over a VLAN to an internet connection, so it doesn't touch the NHS network as such.
So there were some architectural constraints that affected the installation of the infrastructure. I wondered if you could give me a few more details about that.
So having less access points helped because you had to have less around the place. Certainly in part of the Victorian administration block, there's very high ceilings, so it was very impractical to have an access point in the stairwell. But we found we could put them on the end of the corridors and in the meeting room, and that covered all of that area quite happily. So as people walk down the corridor, they still pick up the signal, and in the committee room or boardroom.
With Microsoft Link in use and employing a green and red light system for availability, calls can be answered anywhere. Staff can also sync their diaries via their own smartphones. But how does Bedford plan to further evolve its new mobile communications system?
The future is looking towards Windows 8 devices. We can take advantage of more modern tablets that are more enterprise friendly. iPads are more personal devices, but if it's web-enabled things, then that's fine.
Bedford's mobile rollout isn't just about tablets. Chief Pharmacist Nick Jones explains an innovative new way to dispense medicine, making key use of the wireless infrastructure.
This is a replacement drug trolley for nursing staff to go and administer drugs. And so with the wireless network, they're now able to actually take this into the bay, just as they did do with a traditional trolley. But on the screen, they would have the prescription for the patient, and they would then call up the particular drug, note that it needed to be administered at this point, take the drug from the trolley, check the patient, do all of the traditional things that nurses have to do. But they'd be actually able to record the administration of the drug immediately on the system. They could also identify things like supply and other issues. The pharmacy would come and view the same material. And medical staff would use just a laptop on a standard trolley to actually monitor and alter the prescriptions and see what's happened to the patient's drug administration. So we're linking together all of those things, and including pathology and other aspects, straight into one prescribing and administration system. So we started this project in actually rolling it out in January, and we completed the first ward by March of this year. That was only possible because we had a pre-existing wireless network. So the wireless network is across the whole hospital, so we will be rolling this out now across all of the wards. Nursing staff find this so much easier to use. Traditionally, drug charts are lost in different locations because they have to be sent to the pharmacy for a supply. They have to be they're taken off the ward by various individuals who've taken it for a particular purpose. But of course, when the nurse comes to administer on the drug round, they waste time trying to discover where this is. If they need an altered prescription, they can contact the doctor, who, if they're confident about the need to change the script, they don't have to visit the ward, they can get onto this system anywhere in the hospital, alter the script, patient dose can be administered. So you end up with proper management of medication, clear information about whether the drug has been administered, when it was administered, whether it was late. So you can follow all of those patient safety issues much more easily than is possible by a traditional drug chart.
By increasing contact with patients outside the hospital, strengthening communication within, and even helping to cut costs, it's clear that an improving focus on technology is already starting to pay dividends for the National Health Service.